Well, good afternoon, and first of all, thank everyone. I would like to thank everyone for being here today. This is an exciting day to really announce a partnership that's been in really the works for a couple of years now. The leadership at Shelton State has been just incredible to work with as we've discussed shortages and workforce issues in West Alabama, nursing, all the other disciplines. There's a lot of non-credit conversations that have really gone on the last 2 years leading up to this, and we're just really excited to announce the nursing program that's going to start here on our campus this fall. So really pleased to have the leadership team from Shelton here, our leadership team as well, and all the people that have been involved to kind of get us to today. Just really looking forward to kicking this partnership off, which is officially today, I guess, but really several months leading up to get us here. So thank you to everyone that's here and covering this, and we just look forward to creating this access for students in Bibb County with evening classes and things that really kind of accommodate those working adults, but also those young people that want to get into the nursing program, and hopefully creating a pipeline and certainly an opportunity for people to work here on our campus, but also in surrounding communities. So just would like to thank everyone, and certainly President Cox, thank you for being here with your team, and Andrea as well, and Camille, who's really ran point for Bibb Medical Center from the beginning on this project, working with many of the people in this room today. So we couldn't have got here without everyone really working together, and just certainly appreciate you coming down today and announcing this formally.
Yes, sir. Well, thank you for having us, and what an exciting time. If you have not got to visit this venue here in Bibb Medical, I'd encourage you to do so. But it's exciting because we feel like this is an opportunity to get into rural Alabama and help with rural Alabama health care. And one of those, nursing is important, as everybody knows, but we are able to come here in a partnership with Bibb Medical and really hone in on trying to partner and create a nursing pathway for adults and graduating students, and for that matter, even students that are in high school, to be able to become nurses and hopefully feed the pipeline of need here in Bibb County and the surrounding area.
Sounds good.
Whose idea was it first to approach each other? Who approached whom first?
Yeah, I think
Before my time.
Yeah, I think I'll speak to it a little bit. Obviously, I've grown up in and around West Alabama, and we were discussing that earlier, and certainly am familiar with Shelton and some of the incredible work. The reputation of their nursing program, the nurses that we've hired, created great interest in on our part to really find out more about what they were doing and what ways we could potentially partner. And really, Camille, was on a Zoom call, I think, and it was really a workforce development call for West Alabama, and really, I think, challenged the group on what things could we do. We had a lot of ideas, but needed to further discuss. And I think the leadership from Shelton really responded in a very favorable way. We had a group of probably 12 people that came down to our campus and really responded to that challenge and conversation. I think we wanted to be part of something we looked out and saw was good, and that's what the nursing program and the reputation in West Alabama has created, and that was really the beginning, I guess, of those conversations.
Y'all can decide who would be best to answer this. Feel free to jump in, multiple of you. We know that nurses are needed now more than ever. How crucial is it to create this partnership right now when there is that great need?
Yeah, I think certainly there's no time greater than now. I think that the last 2 years we've all, whether you're in healthcare, you're surrounded or affected by healthcare, workforce challenges are from every gas station to restaurant. We understand it's not just healthcare, but right now our hospitals, our nursing facilities, our clinics have really been pushed to an extreme, and there's a dire need, I think, for more critically than ever, truly, to get this right, to make sure that these pipelines, these pathways, whatever you reference, that they are established and not just established but sustained. You know, we want to see it. We want to see it move forward in the right way. That's why we wanted, you know, the right partner. And you know, I think with the right people collaborating and both people, you know, mutually providing, not saying, you know, look what the school's not doing, look what these healthcare guys are not doing. They're not doing this right. You know, it's really more of what can we do together. And I think that's, you know, ultimately what will make this work.
When is the first day of classes?
Classes will begin during the fall semester, fall 2022. We will be accepting applications from June 1 to July 1. In the meantime, there's a lot of little things, that information sessions that we will have, and packet compilation, and my team at the Shelton Martin campus will be doing, and those are the things that we'll be doing prior to the selection of the first inaugural class.
Okay. Is it September 1st? What, do you know the actual date in which classes begin? It's okay, but would you say
August,
Okay.
August 16th.
All right. Is this an LPN or?
This is a practical nursing program, and they will be eligible to take the licensure to become licensed practical nurses. So it is a 3-semester program. So that will be fall semester, spring semester, and they will finish in August of next year.
Okay, does that mean at the end of August of next year, they take the exam and they're a fully licensed RN?
Correct. No, they'll be a fully licensed LPN.
LPN.
The answer to this question will vary, but what will these students have access to? What would a typical day of this partnership look like for the students? Or who's best to answer that one?
What exactly are you asking?
What would they be doing?
Okay. So, you know, as I entered, and I like to call this a compound, there are varied experiences here. They will have anything from acute care, they will have emergency care, they will have a little operative care, they will have geriatric care, they will have community health. And I also noticed the health department across the way when I entered. So I'm looking at community health opportunities there.
If I could piggyback off of what Chelsea said in terms of academics or curriculum, what sort of courses will they take? In other words, this may sound stupid, but I guess anatomy right off the bat, or is it more hands-on, practical type stuff? What sort of curriculum are they looking at?
So we are looking at offering the academic classes here, and we will offer those in increments. But certainly that first, second, and third semester nursing courses, it will be face-to-face, hands-on on this campus.
How valuable is this going to be for your students to be able to get in here and get this hands-on experience?
You know, I think I can just put it in a nutshell. We are meeting the students where they are. Students that may have problems with transportation and maybe time schedules. They won't have to travel. They'll have their classes here.
That's awesome.
This is early May. Do you have a pretty good indicator? How many have signed up already? I know the starting date is June 1st.
Right.
Have you been reached out? Do you have any sort of gauge of what the interest is like so far?
Initially, we had the conversation. We know a need is there, and we're looking at our demographics from our students that have applied and are actually traveling to Tuscaloosa. That's one thing to identify the need. Also, the actual employees that are here that would like to increase their education, those are certainly candidates to enter our program.
How many students does Shelton have in the nursing program right now?
246.
Wow, okay.
What would you say at this point, and I guess I'm talking to you for 1 second, when they pass the LPN license exam, starting salary will be what, if you had a guess? Just a range.
Yeah, so just putting in salary and not hourly range, it's roughly $38,000 is what the annual salary would be. Of course, that doesn't include shift diff overtime. All our nurses right now are working extreme hours, so there's great opportunity beyond just a 40-hour work week for those that can.
And I guess it goes to say that with rural healthcare, because we're doing this partnership, it is fair to say that your hospital, and we know what has happened in years past, you're in very good financial health. Otherwise, you wouldn't be doing this.
Yeah, I mean, certainly the balance sheet, the financial health of the organization, but again, just the extreme circumstances and times that we're in, and the projections moving forward that are concerning, even if you're in a healthy place today, is the level of overtime, the level of attrition with staff coming up on retirement and things that are happening, medical issues that come up with staff. So those are things you can't look at where you're at today, and certainly we're in a good spot, and that allows us to do things like this. But we're also trying to prepare to make sure we stay in that space, and we know that there's nothing more important from a capital standpoint right now than human capital. That is certainly our biggest priority.
For folks out there who may not know the difference between an LPN and an RN, what is that difference, and how great is the need for LPNs here at your hospital?
So first of all, the need, I mean, a great need. I don't have the statistics in my head, but I mean, we're working, like he said, nurses are working extreme hours, overtime. The difference in an LPN and an RN, and you can speak to this as well probably, the LPN is more skills based. They do hands-on. Most of our LPNs are in our long-term care or even our rural health clinics, and our RNs are those critical thinkers who do the assessments, who have the responsibility of making decisions. And not that LPNs don't, but they work under the RN most often. I was a LPN graduate from Shelton State Community College. Ms. Bowden Evans was my teacher. So when we started having these conversations, it was exciting to have her in the room because she was impactful in my nursing career. Fortunately, I moved here from Tuscaloosa and chose to work here over working somewhere else. And Bibb Medical Center I've built a career here, fortunately. I started out in the rural health clinic as an LPN, and then I did eventually go back to RN school, and I've worked as a nurse in acute care, swing med, now administration. I've done a little bit of everything, and that is the great thing about Bibb Medical Center and rural health is that there are so many opportunities. Like Ms. Bowden Evans was saying, we have endless opportunities here if you want to grow and learn. And I say, what better time than now? I mean, we have gas that's $4 a gallon, and you don't want to drive. So like she said, we're meeting them where they're at, and we're bringing it to the people and making it available to serve their community in healthcare. So.
Your story sparked another question from me. As a product of Shelton's nursing program, how proud of you how proud are you of this collaboration?
I am so proud, so proud. It has been great. I mean, Channing Marlowe has really, kept this fire burning, and I really appreciate everybody that's been involved. I mean, the Zoom calls, like he said, have been effective and it brought us here. I mean, this is where we wanted to be, and I'm excited to be a part of it and to say that I am an alum of Shelton State.
I have one last question, and anyone can answer this one. A lot of people out there, and even some students, may have some misconceptions about working at a rural hospital, working in rural health. What would you all say to someone about this profession, working in rural health? Working in a bigger city at a bigger hospital doesn't always mean better care.
Sure. I think I'll touch on that, Camille. You may want to add to this, but I think Camille really touched on it with the compartmentalization earlier. Really, in the community hospital setting, there's so many opportunities in a nursing home, in a hospital, in a clinic to really do all those things and not to be really, pigeonholed into, okay, this is what my job is. I'm in this role, and that's what I'm going to know and know it every day. I think the diversity of what we do is really what creates, I think it creates opportunities to not get burnt out because that you can, kind of migrate around a little bit easier and, be exposed to those different things. So I would say that's a big part of it.
Say your opportunity for growth is here in a rural hospital, just because of everything that we've said, that there are so many different areas that you can move, change, learn, and grow, where at a bigger hospital you may or may not be able to do that. But I think here you can probably do that quicker if you are, if you have initiative and you want to get out there and learn something new, then those opportunities are absolutely here in our hometown.
And I would just add, I guess, in ending, and I know that you can speak to this probably better, but, LPNs, it has changed over the years as far as what their role is when you ask Camille the skills question earlier, but I can assure you it's not just rural hospitals looking for and to create these pipelines. If you look at what Huntsville Hospital's doing, everybody made a huge mistake years ago by removing the LPNs off of their units and really going, and I think some of that is changing and evolving, and it's going to put pressure. You're going to see a lot of these announcements. There's a lot of interest in this and really trying to create those opportunities again, and not just have them in a nursing home setting or in this setting, really giving them access to all settings so that they don't feel like that, well, if I'm only an LPN, I can only do this. No, we want them to really know they can really do anything that we have here, and I think that you'll see the urban people embrace that as well.